Hi, this is Dr. Kirk Lozada. I'm a facial plastic surgeon and rhinoplasty specialist at Penn Medicine Becker ENT, and this is 2-Minute Consults. An endoscopic brow lift involves making little tiny incisions in the hairline, and that allows a little tiny camera to get all the way down to the level of the brow when we talked about the orbital rim or the bony rim here. By using smaller incisions and then looking at things with a tiny little camera, we can really minimize the amount of damage and the amount of recovery for the patient after surgery. What these cameras allow us to do, it allows us to get to the point of where the eyebrow needs to be lifted. If we simply just made little tiny incisions and pulled up, this unfortunately wouldn't last. The key to a long-lasting brow lift is to release all of the attachments of the eyebrow to the bone underneath. And by doing an endoscopic brow lift, by looking from the inner part here, the medial part, as well as releasing the outer part of the eyebrow here, we can effectively raise the eyebrow into a more natural, rejuvenated position, but really minimize the morbidity of larger incisions and a much larger recovery. For an endoscopic brow lift, there are typically 5 incisions. There's 3 small, I would say about a 1.5 centimeter long incision within the hairline here. There's a second one here, a third one here, and then to lift the tail of the eyebrow, we have about 2 centimeter incisions back in the hairline here and here. So there's 5 small incisions, which is much better. They're all hidden. They're much easier to recover from, especially from a big, large brow lift incision that is along the entire length of the scalp. Unfortunately, for an endoscopic brow lift, this is not something that we can typically perform in the office, simply because there's quite a lot of things that we need to do that patients find a little bit uncomfortable. It is my preference to do these when patients are asleep in the operating room.